Hi, I'm Jen with Pensacola Mom Collective, and I am here with Dr. Samantha Johnson, who is an OBGYN with Ascension Medical Group Sacred Heart. Dr. Johnson, thank you for being with us to answer some really important questions about the topics of pregnancy and childbirth and delivery.
Thank you for having me.
Can you tell us a little bit about yourself and your background?
So I graduated residency at Sacred Heart about 2 years ago now, but I'm originally from West Virginia, and that's where I did my medical school with an emphasis on global health and rural communities. So I spent a lot of time overseas and did a lot of OBGYN overseas as well. And then stayed whenever I graduated here because I really enjoyed the group I joined, and I like working with Dr. Stonecker. He's my partner out at Milestone, and then I deliver babies at Sacred Heart with the other OBGYNs there, Dr. Duke and Sontag and Lyle and Medlock and Turnbow.
Great, wonderful. Well, first and foremost, so you think if someone thinks that they may be pregnant or they have taken a home pregnancy test and have that positive result, when should they call your office? When do you want to see them for the first time?
So I do things a little bit differently than some of the other groups in town. I let people come in and see me no matter when after a positive pregnancy test or before. If they're really worried, they can come in anytime. I know that there are some places that want you to wait until like 8 or 10 weeks. But sometimes the anxiety and the stress of it gets to you, and you want to have a chat with your doctor beforehand. So I let anyone come in, but typically so that you can see something on an ultrasound, we wait until about 8 to 10 weeks.
Okay. I love that because I remember it's been a while since I've had my kids. My kids are 12 and 10, but I remember that pregnancy test the first time.
Yeah.
And I wanted to go in like the next day,
Yes.
and they said, oh, 8 weeks. And it was the longest, like 4 or 5 weeks of my life, it felt.
Yeah.
And so I love that. And I love that you also are thoughtful enough to address those kind of new expectant mom concerns, especially in those early weeks. And so I love that.
Yes. It's scary.
So what can going through pregnancy, that's 40 weeks, 3 trimesters, what can moms expect during that first, second, and third trimester?
The first trimester is definitely getting adjusting. Some people have some morning sickness. Your doctor's visits are normally once a month. You'll have lots of fatigue for some people. The second trimester, I think, is like the honeymoon trimester because you're cute and pregnant, but you're not too pregnant, and you're over the morning sickness and the fatigue. Your visits are still about once every 4 weeks unless you're having some issues. And then third trimester, things can get a little bit more uncomfortable, and then you're like running the end of that marathon, and so you're trying to get everything together, so that can be kind of stressful. Or you just are nesting and it's kind of blissful, and your visits become more and more frequent, so the time seems to start going by quicker. And then overall you get labs. If everything's routine, you get labs in your first trimester, and then again at 28 weeks. You get an ultrasound when you come in, and then you get another ultrasound at 20 weeks. And then we typically do one more like 40-week post-date ultrasound to make sure everything's okay. But if you're like routine, that's kind of how it goes.
Okay, that's great. That's good. I know I think, the ultrasounds are kind of always like really fun and exciting, and
Yeah.
and those are appointments you look forward to. And
Oh,
I
yeah.
think that's, yeah. But I know that third trimester, as you are uncomfortable, you are kind of done, but at the same time, like you are going to see your doctor so much more often that it starts to feel like, okay, something really is going to happen soon. I'm not going to stay like this for the rest of my life, which kind of felt like that at some times for me. So that's great. What about like books to read and classes to take, both for moms and dads? I know like when I had my kids, what to expect when you're expecting, that was like on my bedside table constantly. But are there other books? Are there other ones?
Funny you say that, because that's the one that I recommend for most OBGYNs, tout that book. And it's still the one I recommend to people. It's cheap, it's easily accessible on Amazon. It kind of is all encompassing. There's just so many resources out there right now, to be honest with you. It can be kind of overwhelming, I think. So really, you know, I tell mamas, like, first and foremost, you know, trust your own intuition, and bring a list of questions to each visit, is how I handle some of that educational stuff. So if you're worried, call, but make sure that you pick 1 or 2 books only so that you're not getting overwhelmed. And What to Expect When You're Expecting is a really good one. It's my favorite. I don't have like any other big favorites. It's the only one I've really read in its entirety. But there's a lot of like other cute ones out there that I've skimmed through, like Zen Mama. There's, you know, a couple celebrities that have written kind of like mama how-to guides for the OB and postpartum period. There's a couple good ones out there that I've like skimmed through. Zen Mama is one of them. But yeah, there's just so many resources. I would say pick 1 or 2 and then just stick with that. And then ask your doctor if you had any questions about it once you read through them.
Yeah, that's great. That's really good advice, because I think you're right. Like, we're in such an age of like too much information, and then you get conflicting opinions and different perspectives, and you're already feeling like you don't know what you're doing, or that you're doing something wrong, you're doing too much of one thing and not enough of something else. And kind of, I think that's really, really good advice. I think that's super actually applicable in all areas of anyone's life, of like, stick to 1 or 2 sources, and
stick to 1 or 2 sources, and trust your own intuition and gut and mama gut, and you know, bring your list of questions for your visit, and call in if you're really worried.
Yeah, I love that. That's great. What about, we're obviously now it's November and it's flu season. And obviously we've also been dealing with the COVID-19 pandemic for the past, you know, year and a half or more. And so obviously there's, speaking of conflicting information and too much information, what is your advice in terms of vaccines, both for flu and for COVID-19, as far as new and expectant moms are concerned?
So the 3 big vaccines we recommend and are approved by ACOG and the Society for Maternal Fetal Medicine are Tdap flu and the COVID vaccine, either one of your choosing. And, you know, both societies have come out and recommended all 3. The flu and Tdap have very commonly been given for as long as I've been alive to pregnant ladies. And, you know, the flu, if you get sick with the flu and you're pregnant, it can have very serious consequences for the mom and the baby, which is why it's important to get your flu shot once a year if you're pregnant. And honestly, the same kind of thing applies with the COVID vaccine and the COVID infection. Getting it has very large implications for mama and baby getting infected with the virus. And, you know, we're seeing a lot more studies come out now about increased stillbirth rates and blood clotting rates in moms who've been infected. And, you know, I don't think that any one of us has every single answer to anything out there right now. Myself included. And so I tell people, you know, at the end of the day, like, obviously it's everyone's choice, and my role and all of our roles is just to kind of guide you through your decision-making process. But, you know, all the societies have approved the vaccine to be given to pregnant women, and it's been shown to be safe. It's probably one of the largest administered vaccines to pregnant ladies in the history that I know of. Besides the flu and Tdap, you know, and I think the implications of actually getting the infection are far greater than the vaccine at this point for pregnant mamas or immune compromised people.
For sure. And what about timing and spacing? Like, if you did want to get both either the COVID and or the flu vaccine, when is that recommended to do during your pregnancy?
You know, to be honest with you, they the CDC changes those guidelines on me really quick. They used to have these like spacing requirements for like Tdap, COVID, flu, all this. but I think they're backing off a little bit on that. So to be honest with you, I look it up every time someone comes in and wants to get them close. Okay. To be completely honest with you.
Yeah.
Because they were recommending like so much time between them. And now I think that they backed off on that and you can get them back to back now. But you know, at one point they were saying like 2 weeks or something. But you know, as long as you get them at some point during your pregnancy, the flu and the COVID, that one doesn't matter. Tdap, we like between 28 and 32 weeks.
That's great. Good. And also obviously if you're seeing your doctor for all of your regularly scheduled appointments, this will all be, especially during cold and flu season, these will all be conversations that you're having, right, with your doctor anyway.
I routinely get flu at any point that someone walks in and wants it and is pregnant.
Yeah.
Tdap 28 to 32, and then COVID whenever you want it as well throughout your pregnancy.
Okay, great. That's good. And tell us a little bit about the women's hospital at Ascension Sacred Heart. I had the opportunity to tour it a couple years ago, like right when it was opening, the new hospital. And we had just moved to town and I couldn't believe how beautiful it was. I couldn't believe all the different specialties and capabilities, but at the same time making it feel kind of like a warm, comfortable environment and not feeling like overly like a hospital kind of medical sterile environment. So tell us a little bit about the hospital and what the delivery experience there is like.
So to be honest with you, that's different for every person and their situation, you know, like their medical situation and all that, just because OB's a roller coaster ride, you know, being pregnant's a roller coaster ride. And so it can change on a dime. But we have a very well-trained and capable staff, an amazing NICU. I really think that everyone does their best to, you know, be there for you, guide you through it, let you know what's going on. Because it can be a lot of poking and prodding and feeling like you're out of control of your own situation. You're in a new environment, and then you add COVID on top of all that. And I think our staff, for the most part, does a really amazing job at putting people at ease and guiding them through that process so they feel more in control of their own body and life and going through it as well. We do have the new low intervention suites that have been redone and are very nice. The main L&D floor, they're working on renovating, but nothing major has been done on that floor as of right now. And then we have the new NICU and women's and children's side, which is amazing in case your little one goes over there. But it is it's a good place to deliver a baby.
It really is. We're hearing from Amber Price also in the context of this conference about who's a midwife at Ascension Sacred Heart, and hearing from her as well on the low intervention birth suites. And I know that's, in a way, I think for a lot of expectant moms, it's a nice kind of best of both worlds, right? So you have the low intervention experience, but the NICU is right there if you should need it. And so I think it really gives you the full spectrum of meeting your needs, particularly for labor and delivery.
Yeah, it does.
That's great. And I guess just to wrap up, like what's your big piece of advice for moms, dads to prepare for a healthy baby and a delivery?
I think that it's a hard one, but I think it's that, you know, you can't be married to any one idea or way of doing something. You've got to be able to like roll with the punches and like accept that there's going to be twists and curves, and that can be really hard. And then accept that, like, you know, at times it's going to be an emotional roller coaster, and that life throws us a bunch of curveballs, and sometimes we just gotta roll with it, you know. I think that can be very hard, especially in this day and age. But I think that, like, if like even me going through it, or you know, my sister-in-law going through it, or a family member, like that's what I would tell them, right? Yeah. You got to expect the unexpected. You've got to be able to roll with like sudden changes and curves, and you know, just trust that like we're all there for you and going to help you through it.
Yeah, no, I think that's spot on. I know, I have 2 kids, and neither delivery, and I'm just talking about the delivery phase, but neither
Yeah.
delivery unfolded in any way, shape, or form the way that I had envisioned. And even after the first
Yeah.
time, right, I was like, oh, well, that's how it went the first time. But this second time, no, this time it's going to be like this. And I still didn't learn my lesson. So, no,
Yeah.
I think that is absolutely solid advice to expect the
That,
unexpected and be ready to just pivot and roll with the punches. And I think if the pandemic has taught us anything, it's pivoting, right? I mean,
yes.
we have all
Yeah.
become really expert pivoters,
We
and
have.
so I think that that's really wonderful advice, and we just
And
appreciate you being here.
another
Thank
thing
you.
another thing I tell my mom is that like the best birth story is your birth story. It doesn't have to look like anything, you know what I mean? Your birth story will ultimately be the best birth story because it's yours, you know?
That is the truth. That is the absolute truth. Thank you so much for
You're
sharing your
welcome.
expertise with us, and we're fortunate to have you here in our community, caring for our moms
Thank you.
and the women in our community. So thank you so much, Dr. Johnson.
Oh, you're welcome, hon. It was good chatting with you.